afternoon, good evening from wherever you are watching us from, as we seek to build back better and bolder the Reproductive Health Network Kenya, the Center for Reproductive Rights, Root Girls, and Safe to Choose are glad to welcome you to this live webinar where we will be seeking to discuss more about mHealth and just trying to see how do we increase access to sexual and reproductive health information and services through the new technologies that we have. So basically, as an organization, we all are aware of the, not only to women and girls in Kenya, but across the region and across the globe. Increasing access to sexual and reproductive health information and services, especially during the pandemic, is our core business as the organization and our partners that will be participating in the webinar today. The world is embracing technology, especially in improving access to health and mobile telemedicine devices. With approximately 5 billion mobile phone users globally, we then have opportunity mobile technologies to play a formal role in health service delivery. Income countries the mHealth and providing SRH information and services through the use of our network providers. And when we talk about of the, we are using telemedicine and our women access these services using that has been very effective, especially during the pandemic, increasing access, and this through is or just services that they need. So we're really excited and looking forward to this amazing conversation. We have amazing that will services, and we will be looking at what laws also do we have that guide us, especially. So without further ado, I think I want to hand over the session to
Thank you very much, Nelly. My name is Saskia, and I'm very happy to join you today live on this very exciting webinar. I work at Rutgers, which is based in the Netherlands. We're an IPPF member association with international programs. I'm senior technical advisor on contraception and safe abortion. And early 2018, I was responsible for the setup of the She Makes Her Safe Choice global program, a program that's collaborating with a variety of partners to end unsafe abortions. And we also work in Kenya, as some of you will know, and our consortium consists of DKT Kenya, IPAS Africa Alliance, Sujaz Inc., Women First Digital, including Safe to Choose, the Africa Population and Health Research Center, and of course the Reproductive Health Network Kenya, who's hosting this live webinar today. And in our consortium for the Safe Choice program, each partner really plays an essential role, either in awareness raising about safe options, product distribution, stigma reduction, training of providers, advocacy at various levels, research, campaigns, and mHealth, that's the topic of today, is really a key component of Safe Choice program. And all our partners are somehow working with online solutions. So today we are going to talk about mHealth, and I'm not going to lecture you because I'm not an expert, but I do want to stress the importance of this constantly evolving development. And I do want to share a bit of background information. And I think it's very interesting to have this dialogue with partners in Kenya, because Kenya is really a front runner. For example, with mobile banking, the M-Pesa was an example globally of how Kenyans were really quick in adapting with mobile technology in the financial sector. And such technologies can also be applied to the health sector. And that's what we want to talk about today. Already in 2010, the World Health Organizations noted that information and communication technology, ICT, have a great potential to address some of the challenges faced by both developed and developing countries in providing accessible, cost-effective, high-quality care services. And earlier, these technologies mainly involved telephones, hence the word telehealth. Health providers linking with their patients via mobile phones. And more recently, approaches are also involving the prescription and ordering and delivering of medicine to the patient. This is called telemedicine. So without getting stuck in all these abbreviations, we want to talk about mobile health. So the use of any kind of digital application in healthcare, both from the provider side and from the end user side. So with the onset of COVID, as Nelly already mentioned, we saw increases in gender-based and domestic violence, increasing numbers of unintended pregnancies, and a general less essential branding of healthcare services. So to address that, we saw a rising trend in mHealth coming up and other online solutions to keep informing, counseling, and providing services, especially to women and girls, not just in Kenya, but that's a global trend and that's continuing across the world in many different countries. So, as we announced, this webinar seeks to understand the progress and the effectiveness of using mHealth in providing critical sexual and reproductive health services, including abortion services in Kenya. So, I'm really pleased to be moderating an exciting panel today. And I want to present you our 4 panelists. So let me introduce them to you. Our first panelist is Mr. Martin Onyango from the Center for Reproductive Rights in Kenya. Welcome, Martin. Martin joined SRHR in 2017 as the Senior Legal Advisor for the Africa Program, and he's responsible for spearheading litigation in Kenya and supporting program strategy on litigation and related advocacy. His work is focusing around supporting the development of capacity building strategies, cultivating pro bono relationships, and representing the center at a regional level. Karibu sana, Martin.
Thank you very much, Saskia.
Thanks for being the first panelist to join us today. And I really wanted to open the floor by just asking you a very general question on what are the legal aspects and the WHO technical guidelines around telemedicine and mHealth, and what's your experience with that?
Thank you very much, Saskia. For purposes of our audience, I would want to localize the WHO standards into the local Kenyan standards so that our viewers do not think we are talking about things in the utopia. But Kenya is a signatory to the WHO statute, so we align a lot of our health standards with the World Health Organization standards. So coming down to Kenya, health is a right guaranteed in the Constitution and the highest attainable standard of health. The consumers of health as a service are entitled to enjoy services provided with the highest and the latest available technology, so that in terms of regulating healthcare, government is under an obligation, including to ensure that access to healthcare is offered in the latest available standards and using the latest available technology in the country. When it comes to use of technology in provision of healthcare, Kenya has had an experience that I would say is the reverse. Traditionally, practice precedes regulation. In Kenya, we have moved steps further with regulations, almost ahead of the practice. Because when we talk about mHealth in particular, and mHealth, it is good to clarify that mHealth is just an aspect of use of technology in healthcare. But when we narrow down to mHealth, we are talking about the mobile phone or portable devices being the medium through which the provider and the patient get to communicate, and service is offered through the use of that medium. I would not belabor what you've said about mobile penetration in Kenya, about 95%. Largely, almost every adult has access to a phone, and it also means that then minors under the support or guidance of those adults have access to a reasonable access to a phone. So Kenya has made several steps and put in place several guidelines to safeguard the use of technology in provision of health. Foremost, beyond the constitution that guarantees access to health and also guarantees consumers the highest quality of services, the Ministry of Health has pushed through Parliament a Health Act that recognizes the use of technology in provision of health. And the term used in our health law is telemedicine, which refers to provision of healthcare services and sharing of medical knowledge over distance using telecommunication, and it includes consultation, diagnostic, and treatment services. That is what the law acknowledges. But you know, laws are not self-executing. So the Ministry of Health in Kenya has developed several policies and several guidelines to enable consumers in Kenya access healthcare through the use of technology. And in no particular order, I will start with what is most relevant to our discussion today. In 2017, the Ministry of Health put in place the standards and guidelines for mHealth systems in Kenya. Primarily, these guidelines then put the mobile device at the center of provision of health between the provider and the client. And in just looking at what the mHealth guidelines provide, these guidelines set up, one, how to have a framework within which the provider can consult, can review, can prescribe a mode of treatment, but also guide, for example, the delivery of medical prescriptions to the patient. It also provides for safeguards in protecting client information, ensuring confidentiality, ensuring that informed consent is obtained from clients for the treatment being offered, how to apply mobile technology in health during emergencies, the use of electronic prescription, authentication of prescriptions, the delivery of electronic prescribed drugs, and of course the management of digital database and how to operationalize the entire framework of the use of the mobile phone as the medium for provision of healthcare in this country. The mHealth guidelines therefore provide a comprehensive framework focusing on one, the technological environment, the personnel, the provider, the patient who is receiving care, but also other service providers like pharmacies that would then deliver prescriptions to clients. This perfectly works for all healthcare services, including reproductive healthcare services that would then be delivered through the use of mobile technology and the mobile environment system to take care of patients. I would then look at, of course, the e-health policy that Kenya has running from the year 2016 to the year 2030. That the mHealth guidelines have been developed in a policy framework where the Ministry of Health in Kenya acknowledges that the use of technology to provide healthcare must then be secured within a national policy, and that is what has been done in the e-health policy running from the year 2016 to the year 2030. Of course, alongside the e-health policy, the government developed a e-health national strategy from the year 2011 to the year 2017. That has never been revised or repealed, so it is the existing national strategy to implement the e-health policy. And of course, the mHealth guidelines that we've discussed earlier find anchorage in the e-health policy and strategy. The long and short of what I'm saying is that there exists sufficient constitutional protection, statutory protection, technical guidelines in the form of standards and guidelines for mHealth and the national e-health strategy, and a very broad policy framework for e-health service delivery for Kenya. And what therefore is the gap or could be missing is the taking up of these opportunities, the taking up of this environment by both care providers and patients seeking care to optimize the use of technology to bring services closer to our people, to optimize the use of technology to overtake stigma that limits access to care. For example, when it comes to abortion care, reproductive healthcare services like contraceptives, where you have patients who are hesitant to physically walk into a facility because of stigma, because of their religious and cultural backgrounds, because of hostilities that may exist in their environment, or because of prevailing challenges like COVID, then the use of technology becomes the solution. And it fixes then the distance between the patient and the provider. It fixes the challenges created by stigma, but also challenges created by limited number of providers, because by the use of technology, many clients can then get attended to by one or few providers. And it's not lost on us that the use of technology has been around for a while. We've seen organizations, including partners in this call, who have been providing information on websites, providing toll-free lines, toll-free call centers. These find perfect footing within the constitutional statutory and policy framework for provision of e-health or mHealth specifically. I hope I have not confused our listeners. Thank you.
Thank you. Comprehensive. I'm not confused. I'm really enlightened, and I'm very happy also to hear how adaptive the policy context in Kenya actually is, because these developments are very, very quickly changing. So it's very important to keep up to speed. I thank you also for summarizing your own points. I think you did a very elaborate detailing of the legal aspects and the policy environment in Kenya, which helps us to zoom in. And you talked a lot about clients. So I now wanted to move to our next panelist, because unfortunately, Martin, our time is up. But thank you again for your contribution. I wanted to move to our second panelist of today, Ms. Rita Anindo Obonyo. And Rita is a fierce sexual and reproductive health advocate, and she's affiliated with the Reproductive Health Network Kenya. Rita is also a fellow with the Young African Leader Initiative and a former member of the Youth Advisory Council for the Nairobi Metropolitan Services. She's very passionate about maternal health, mental health, and also gender issues. And I'm very pleased to have her on this call as well. And we are now addressing this interesting topic from a client perspective. I don't particularly like that word, but I wanted to ask you, Rita, from your personal experience, do you have any experience in accessing services through mHealth? And maybe you've helped other young people to get access. Can you enlighten us a little bit?
Yes, I have experience in accessing mHealth services and even information. I have used applications. I have used mobile to call and get information on especially sexual reproductive health. I'm also a champion, just as mentioned, for the reproductive health, where I help young people from the communities. I link them to sexual reproductive health services and even information. I've also been involved in terms of research and how can we really improve healthcare system as a participant and also as a field interviewer in issues of mHealth. And I would say that it's been an amazing experience because sometimes as young people, we are more inclined to using phones and using social media. But again, just other than fun, how can I be able to improve my health and use the same platforms to really get these services? For me, this is an interesting thing, and even for other young people, because we are more satisfied with mHealth than really going to the facilities and get these services. Because you can imagine, as a young person going to a facility where maybe my neighbor is the community health volunteer or my aunt, and I also have to queue for a very long period of time with other patients for just a contraception method. So for me, mHealth has been an amazing way of really accessing services rather than the traditional way of going to a facility and accessing services. It has also been affordable because sometimes because of these structural barriers such as transport, where I have to go to a different place to access services, it becomes a challenge. But with mHealth, it's just bundles, and bundles are cheaper because I'm using it for other reasons. So it's easier to really call and get this information. It's also reliable because sometimes as young people we will Google information, but you see this information in Google is maybe blogs from people, which this information could not be reliable. But if I'm sure that I can call Nena na Binti and get to talk to a counselor and get to talk to an expert and even a healthcare provider, then I'm sure that I'm able to get reliable information. For me, it has been amazing. And even for the young people I have referred, most of them will tell you, because initially I still used to really link young people to services, but again, if you really link them and tell them go and access this service, they'll come back to you when you follow up and they'll tell you I wasn't able to get a service. But with mHealth, everything is easier. You only call and they're able to access services. When I follow up a young person, there's a positive result. But again, the other way, there's a lot of challenges. So I've said affordability, accessibility, it's more satisfying, and of course, it's more, again, reliable for most young people, and it reduces the stigma, because sexual reproductive health services is really, for adolescents and young people, it's really stigmatizing that a young person like me is on contraception, or a young person like me is seeking safe abortion services. In the community, it's really stigmatizing. But with mHealth, there's a lot of confidentiality, which for me is really is favorable for me. The environment is favorable. So that's all I can say about my experience and the experience of young people I've linked to services using mHealth.
Thank you, Rita. We can hear your passion and also your experience. And we know you're a peer educator. So you also talk to a lot of people, a lot of young people in the different communities where you work. And can you share a little bit on the experience that young people have and how youth-friendly the different platforms are that you use, or if you have any recommendations for improvement?
So we've been struggling with issues of unmet needs for sexual reproductive health, especially for young people and adolescents like me, young people like me. And really, it's because that the facilities have not been youth friendly. There are issues of healthcare providers, their attitudes, having to queue for a long period of time, having, when you want services at 6 p.m., you can't get these services because, and that's the only time you are available as a young person. So we've been having a lot of issues to do with youth friendly services. But with mHealth, I'm able to call Nena na Binti, for example, at 6 p.m. and I'm able to get really these services. I'm not supposed to really queue for me to get services. So I think mHealth, I wish we actually got these solutions early, because we are struggling with issues of teenage pregnancies, unintended pregnancies, unsafe abortions, and mental health. We are not able to curb this because really we have no youth-friendly services, and we are struggling with these. Numbers are rising. We are not able to curb these, and we even have discussions trying to speak about youth-friendly services. Do we have standalones, or do we just have healthcare providers come to where we are? But again, I wish we knew that mHealth is the best solution to youth-friendly services, because with mHealth, all the structural barriers, the social cultural barriers. Now, when I'm thinking about the structural barriers, yeah, issues like transport. Young people, we don't have jobs. How do I move from one place to another and pay for transport, and I don't have a job? When I'm speaking about social cultural barriers, issues of stigma being curbed with mHealth, because there's confidentiality, and they also have individual factors which are curbed by issues of mHealth. So I feel youth-friendly mHealth promotes youth-friendly services.
Thank you so much, Rita. You're a true advocate for the topic that we're discussing today. And we also see a comment from Essie agreeing with you. And I want to also invite our audience to put any questions or comments in the chat box on your screen so that you can join in the conversation. And at the end of our panel, we'll have some time to address some of the questions directly to our panelists. Just a last point to you, Rita, before we have to move to the next speaker. So you really strongly recommend young people to explore the use of technology, because we also realize that not all young people may have access to that technology. So how do you see that? Because there are limitations maybe in use. We heard the mobile coverage is very high in Kenya, but then still the literacy of young people to find their way online. What can you advise, and what would be your message to those young people?
So I am looking at the future of mHealth, because right now we could be facing challenges in terms of limited resources, in terms of even data bundles. But what is the future of mHealth in Kenya? So for me, I would really recommend mHealth, because first it gives it is client centered, it is women centered, it gives us control over services. So for me, it really empowers. So if I would even advise policymakers, let's embrace mHealth, because it really empowers women to take decisions, and it will actually make us be able to meet the unmet needs for family planning, unmet need for abortion services, and GBV, mental health, all that. For me, I would really recommend mHealth. Another thing I also speak about is the issue of building resilience. You see, when COVID came, we had a big challenge because most people, we've been going to the physical facilities, and now people fear COVID. People are not able, people are discouraged to visit facilities. So with mHealth, we are building resilience in these systems. With mHealth, we're able to achieve sustainable development goals. For me, looking at how can we really expand this with limited resources, we have other ways we're able to do this. And I would also really, we can use the radio to encourage people to go to this platform and even increase demand of services using some of these platforms.
Thank you so much, Rita. You're truly inspiring, and I hope many young people and people working with young people are on this call to spread your message. I want to thank you here, and unfortunately we can't talk for much longer, but we have two more other exciting panelists lined up. So I have to move forward, but thank you so much, Rita. Then it's my pleasure to welcome our third panelist of today, Ms. Lilian Muchoki, who is the Eastern African Regional Consultant at Women First Digital. That's the organization behind Safe to Choose and many other platforms that we'll hear about in a minute. Lilian is a dedicated women's rights advocate with more than 8 years' experience in promoting the rights of women as an activist, trainer, and researcher. Lilian is very passionate about gender equality and equity in access to sexual and reproductive health and rights. And her current role at Women First Digital involves promoting the access to SRHR information and services through the currently available and the ever-expanding digital technologies. Welcome on board, Lilian.
Thank you very much, Saskia. And yeah, and to Rita, I mean, it's very nice speaking after someone who has experienced mHealth, because it becomes a bit easier to explain what the process involves. And at Women First Digital, we dominantly reach out to women and service providers of sexual and reproductive health services using websites. And currently we have up to 3 websites. So in summary, we run a website that focuses on just informing women, and that is pinkshoes.org. So anyone who is looking for information on safe abortion can easily visit pinkshoes.org, and they're able to, learn more about medical abortion services, and just to create that awareness. It also has a resource where service providers, in a bid to support mHealth, are able to take online courses and gain more information on how to, provide these services in a safe way. So the second website is Safe to Choose, and I think I'll dwell more on this because it has a more personalized touch. So safetochoose.org has been curated to provide both information and support for access to safe abortion in Kenya and around the world. So what happens is that anyone who is looking either just to learn about safe abortion, or just to weigh their options and navigate their options on safe abortion, can visit Safe to Choose, and there you can either read the content that is on the website, or if you have some questions that revolve around the topic of either medical abortion or in-clinic abortions, you can email and someone will respond to you within 24 hours. Now, we also have counselors. These counselors, they're able to also speak to you in a very personal way and just help you to understand what any of the safe abortion options involve. So the counselors are able to speak to you in either English or Swahili, and I'm speaking specifically for Kenya, but globally we have up to 10 languages. So we are trying to accommodate as many people as possible, and our aim is to just empower women, to just help them understand that if I visit a service provider, or if I'm using mHealth, this is what I should expect. Because again, we know there are gaps everywhere. There are gaps in the education sector. There are gaps in even the kind of interaction that we have with the service provider. So we want that by the time this person is going to the service provider, or by the time this person is trying to access any kind of mHealth services, they understand what the process will look like. Above this, we provide referral services. This means that if a woman comes to the website, speaks to a counselor, and they are looking to access safe abortion services, we are able to refer them to the nearest provider where they're able to access resources, localized resources, and they get someone now who they can speak to and guide them in accessing the services that they're looking for. So I know one of the major questions that we usually asked is, you're operating in this digital space. So what are your challenges? Because this is a space that has not been used, in the traditional mHealth provision of care. So, and of course, one of the challenges is that we fear that we won't be able to reach so many women in places where internet connectivity is not so strong. But again, for us, we see this also as an opportunity to work with our partners who are already working on the ground and complement what they're already offering. So for us, they can either send the women to get more information from the website, and we can also send them where they need to speak to someone directly. Another challenge is that in the digital world, there's a lot of, copycatism, whereby, yes, we are providing the right information and the right, the verified information, but then you find that the quacks have now realized that mHealth is the way to go. So they are also trying to go to the digital space and also establish websites that try to copy the real information, but use them to provide the wrong kind of information or services. So again, we work with partners just to make sure that women are directed to the right spaces. We also try to, of course, some people will see data security as an issue, especially in countries. In Kenya, issues of data security are very controversial. And someone might be asking, so I'm coming to your website, I am speaking to you. How sure am I that my data is protected? And on this one, I think one of the things that we've realized is that in order to help someone, you don't need to collect all their data. If they're coming here to they're coming to the website, we collect only the relevant data that will help us to guide them into accessing the service that they're looking for. For example, if you come to the website, you don't have to tell us that, hi, my name is Lillian. No, you can, if you have some other fancy name, you can come and tell us, my name is Chantal, and I want to access this service. The most important thing for us is just knowing your geographical location in case you are looking to be referred. Then from there, we are able to guide you. Then we don't allow the upload of any files on the website that have any files actually. So we'll never be asking you to upload any personal information, and we respect women anonymity. And when we refer you to a number of facilities and provide you with the option to choose from any of them. And I think in a big way, we try to protect anyone who is coming to the website by allowing them the option of making the decision that they want to make. So when you come to the website, we don't tell you, oh, you come to the website, fine, and you want to access this service, go there. No, we have our counselors, that is, they have a very confidential conversation with you, guide you, and the decision is made by you, and you tell us what you want, and we are only able to facilitate according to the needs that you have. And they vary from access to even contraceptives, access to safe abortion, access to post-abortion care, all those services. And we have curated a list of partners on the ground such that this woman is able to access non-judgmental services, safe services, affordable services, and high quality services. So we don't just refer you to random people. We have partnerships with registered healthcare providers who are able to guide you further than what our counselors are able to give from the digital space.
Great.
So,
and your data is very secure. Do you have systems in place for data security, confidentiality?
Yes, we do that. Our data is highly encrypted, and we keep on updating our server operating system. We keep on updating all the softwares that we use on the website, just to make sure that we are not vulnerable to outside attacks. So that is something that we've really invested in, and we have a dedicated IT team whose work is just to make sure that the website is safe, and whatever information that is shared with us is protected.
Okay, thanks so much. And I do want to pick on one question that came in as you were talking. Your platforms are very much focused, of course, on the needs of women and girls. And there's a question if young men are also accessing the different platforms in Kenya. Do you have any experience with young men accessing your information?
You'd be very surprised that the visit to our website, sometimes there are more men accessing the website than women. And this is because sometimes it's the boyfriend, it's the husband, it's the brother, it's the father who wants to have an understanding of this information before they can support the significant women in their family into accessing these services. So yes, anyone can access these services, whether a man or a woman, and you'll be able to be provided with the information and directed to the resources that you need in the navigation of those decisions that are around access to safe abortion. Yeah.
That's great. So that's also in line with like partner counseling that many service providers are really promoting. But of course, that's up to the decision of the couple or the individual. But that's great to hear that messages and information can also be tailored to young men, because that's what we're striving towards, this gender equality. Lilian, I can ask you one more question about the reaching women and girls in harder to reach areas or with less access to mobile technologies. How do you overcome that, or do you leave that up to other partners, perhaps?
And although we are predominantly a digital platform, we have also devised other ways of reaching women who are not able to access information through internet. And one of them is like working through partners in the distribution, in outreaches. So we work with local partners, or we come and we speak about the same content that is on the website. We also distribute information, education, and communication materials that carry the same content that is on the website. Other than that, we have developed an AMP version of the website. AMP is a more limited version of the website, and I think a good example will be how people are able to access Facebook free, whereby they go on Facebook, and even if they don't have data, there are some partnerships that have been formed to make sure that they access, but in a limited form of Facebook.
Like lower bandwidth.
A lower bandwidth. So in the same way, we have lower bandwidth version of both Safe to Choose and safetochoose.org and pinkshoes.org. So anyone who is in a community or in an area where internet penetration is a bit limited, they are also able to access the content with a simple phone. It's just that they may not maybe have as many pictures or as many graphics as the main website. But that has really helped, because especially for pinkshoes.org, we see a lot of users coming in through the AMP version. And so I think that has been helpful to us in reaching those people who have limited access to internet and smartphones. Yeah.
Thank you so much, Lilian. This was very insightful, and I realize we've used a bit more of your time. Thank you so much. And there's a lot of questions and comments coming in the chat box of this webinar, which is really great to see the engagement. I have to thank you and stop you here, but please stay on board for some further questions and dialogue with us. Then I have to apologize our fourth and last speaker for today, Mr. John Daluma, he has severe problems getting connected because he was very eager to share with us from a service provider perspective. As we have a very wonderful host of today, Miss Nelly Munyashia, I hope I don't put you on the spot here, but could you enlighten us a little bit from a provider perspective in terms of that you're working very closely with a broad network of providers throughout Kenya and your health provider yourself? Could you maybe share a little bit with our audience about the use of mHealth solutions with the clients in your clinics, and also how you work on client confidentiality and privacy? Maybe you can take the stance of your provider members of the network.
Okay, thank you. And honestly, I'm quickly fitting in someone's big shoes. But given that I'm also a healthcare provider, and as a network, we make internal guidelines and standard operating procedures for our providers, regardless of whichever services they provide. So mHealth is not any different. We have, as an organization, we are the ones who have been trying to put the guidelines together for our providers to use, and for them to also understand how the legal framework looks like when it comes to mHealth. And Martin has really been very supportive when it comes to that. So as providers, as what the providers have basically been doing is getting referrals, mostly from our Nena na Binti hotline. And in terms of security, then the counselor behind our hotline has undergone a lot of security trainings, and they are able to do a lot of security assessment just to make sure that, one, we are getting the right clients, and we are not getting, we are not receiving how will I call them? We are not receiving ghost clients, because we understand the kind of services that we are providing through our mHealth platforms include abortion and contraceptives. And we want, adolescent and youth to be able to access these services. We want women to boldly access these services without feeling stigmatized, without feeling exposed and all that. So our counselor is able to just quickly screen out to make sure that we have the right clients, and then we refer them. For those that want to talk directly to the healthcare providers, depending with the geographical location, we are able to link them up to our healthcare providers, and they are able again to take them through, the medical procedure of assessment, history taking, and all that is documented, because we say anything not documented is not considered done. So as much as there might be no physical contact with the provider and the client, but the provider makes sure that in case we need, like, for example, tests, blood tests done, then the client will be referred to a nearby laboratory where the tests will be done, and the client will share the results with the providers using the WhatsApp platform. And that way, then the provider is able to issue a prescription, and they safely, go to a nearby pharmacy with the prescription on phone, and they will access the drugs. In terms of confidentiality, then depending with what case we are dealing with, if it's abortion, for example, and the women and girls do not want to be exposed to the pharmacy, then we are able at the secretariat to also deliver the pills right at the doorstep of the client, or we ask the provider to organize. In Kenya, we have what we call boda boda Uber. We are able to, link them up with, the providers use the Uber riders to then deliver the pills to the comfort of the women or the girls. That way, the Uber rider does not know whatever whatever they're delivering. And then in terms of ensuring that there's quality of services, the provider is on call on the other side, providing the client with instructions on how to use the pill, what kind of side effects to expect, and what to do in case of these side effects. So it is a continuous process. And from our Nena na Binti hotline, the counselor is able to also follow up with the client and see if they were able to receive services, if they appreciated the quality of services, if confidentiality was maintained, and also just check up with the provider if they were able to document that this client accessed services in whichever method, either virtually or visited the facility.
Wow, thank you so much, Nelly. It's clearly a topic that is at your heart. Can you share a little bit about security for the providers in your network, especially when offering services through technology? How about security?
So thank you again, Saskia. What we have done, because we get a lot of patients asking for services using our social media platforms, what we have done is we get the contact, we ask the patients to share with us the contact, and we are able to, like the counselor is able to just do a security check to make sure that whoever is in need of the services is a legit client. And in case we have queries on queries on the legitimacy of these clients, sorry about that. Yeah, I just noticed my network here stopped. So if we query the legitimacy of the client and we suspect it could be someone from the opposition, what we do, we are nowadays using a delay tactic, and we just try to see if they will be patient enough for them to wait until we either do a referral or we offer the services. And most of the time, if the patient is not legit, they will not be patient enough. They want a response there and then. They are in a rush to, meet whatever objective they are up to. So our security is a bit tight and we take a lot of delay. We do not expose our providers. We do not give contacts to our providers immediately unless we are really sure that the patient is legit and the patient is really in need of these services.
Thank you so much, and great to hear you have very thorough systems in place to protect both the provider as well as the clients coming in with their needs and questions. And thanks again, Nelly, for being here, putting you on the spot and bringing this provider perspective, which was the point that was still missing from this webinar. So I really want to thank you again. And I'm very sorry that Mr. Delamu could not join us today, but I hope we will have additional dialogue like this and hopefully in person very soon to continue this kind of exchange. And I've been trying to follow a little bit in the chat, and there's been a lot of supportive messages and some questions coming in as well. So if you'll allow me, I would just like to go back to our colleague Martin from SRHR in Kenya. We would like to add a question from the audience to you. We would like to hear a bit more about consent from a legal perspective, especially on using mHealth. Could you enlighten us a little bit more from your experience? I think you are still muted, Martin. Could you unmute and repeat? I'm sorry about this. As we try to solve this problem, we wanted to address our question to Martin about consent. We wanted to hear from him about the legal aspects and what is in the guidelines in Kenya, but it seems like he cannot be unmuted. So I'm just checking in for the other comments that came in. A lot of supportive messages on the explanations that Lilian has provided on digital health care and the various solutions. And maybe, Lilian, I can turn back to you for a moment here, if you're still with us, whether you have any additions to share on whether it's right to say that mHealth really is the new health solution in ensuring access for all to essential services. Could you share some of your feedback on that point there?
Thank you, Saskia. I think we can confidently say that mHealth is really here to stay. because during this COVID time, we and by we I'm talking about everyone in the government, in the civil society, service providers have realized the importance of mHealth in access to any kind of healthcare services, including sexual and reproductive health services. And we have seen a lot of technologies, a lot of usage of technologies emerging. In the recent past, we have seen a lot of chatbots coming up, a lot of toll-free lines and websites coming up just to support access to reproductive health services. And I don't think this is going to end with COVID, because the gaps were always there. And now that we are seeing that these gaps can be filled using digital technologies and other mobile technologies, then it means that the burden is going to be lighter on the service providers, on organizations like ours that provide information, and even on the women and anyone who is trying to access sexual and reproductive health services. So for me, I think even looking at how our governments slowly by slowly are ascending to policies and regulations and other laws to support, then I think that mHealth is definitely here to stay, and it's the future of how we are going to be providing services and support in sexual and reproductive health. Lastly, I loved what Rita said, that it's giving women and anyone, I think for that matter, control of their reproductive health, their choices, and even just access to products and services. So, I mean, anyone would love to always have that kind of control. So once you, and I think for anyone, once you realize the benefits that you get from using mHealth platforms to access any kind of healthcare, I think there's no going back for the users and for the providers. So that's all I have to say, Saskia.
Thanks. Those are very encouraging words, and we also realize that the technology landscape is constantly developing and improving. So we really look forward to continuous discussions on this topic, because it's not set in stone. I'm really pleased to see Martin back online. I'm sorry about your connection there, and I hope we can hear you this time. If you can please unmute yourself and just quickly provide us with an answer on the matter of consent. Martin, please unmute yourself at the bottom of your screen. Oh dear. We see you now, but we cannot hear you. It doesn't seem to be working. I'm very sorry, Martin. You had such interesting points to share with us, but we can't hear you. I'm very sorry. Just for the sake of time, I do have to round up this panel, and I do want to thank all my wonderful panelists for your fantastic contributions. I think we had much more to talk about, so next time we plan for a 3-hour session. But I'm very pleased with the insights we got today, and looking at the comment box, our audience is very engaged and very interested, so I'm sure this is not the last time we will be speaking. Before we round up this webinar, I want to hand over to my colleague Evelyn at RHNK to share some exciting news about Nina Nabinti. So with your permission, I would like to hand back to Evelyn. Please share your news with us.
Wow, it has been a really great conversation, and it's so sad that we are not able to get Martin to really also give us a perspective on consenting and how important that is, especially when you're using telemedicine and telehealth. On how do we consent, how as we as providers ensure that the people we are offering services to are also able to consent. Oh, Martin is here, and now his mic is actually on. Martin, can you hear us?
I can hear you. I could hear you from the onset. It's only that you couldn't hear me. So I thought the muting was from your end.
Oh, sorry. Then I think you can take it up and just help us on the consenting bit, and then as I also set up myself to launch the new phase for Nena na Binti. Karibu sana.
Thank you. And in the shortest time possible, I had two issues to clarify. The issue of information provision, and then the question of care provision, the provision of services. Information provision in all platforms is guaranteed under the access to information in this country. If it is information that would enable anyone to realize or protect any of their rights, including right to health in accessing healthcare. Consent then becomes a question of service provision. And then it is then a matter between the person seeking a service and the service provider. It is upon the service provider, as required by all health guidelines, that they take the necessary information, the necessary history. They then engage the client, and then they inform the client in the language they can understand the nature of their preferred mode of care or treatment, and then the client accepts. It is called informed consent. The informed consent is governed by the Health Act, sections 8 and 9, on how you need to provide information and the client to accept or refuse treatment. The clients are actually entitled to refuse a prescribed mode of treatment if they so wish. So how to ensure informed consent? Technology, it is for the provider to to denote the process and to denote the acceptance by the client. The same process, whether you are using technology or you are having a client sitting physically in person, the standards are actually not lowered when you are now using technology. It is the same standards for provision of informed consent that would still apply, but the mode of documenting informed consent would then change, because when you are using technology, the provider would then be either taking notes in a secure technological platform where they've taken the details. Physically, they would be doing handwritten notes, or maybe in many instances, they would also be using technology to denote clients' acceptance of the mode of treatment. Standards are not lowered when it comes to the use of technology, and we also need to distinguish between provision of information, which can be provided in very many ways, including online platforms, but then provision of information as distinguished from access to services. The interaction between qualified care provider and the patient, and how then technology is regulated to bridge that distance when they are not in the same physical environment. Thank you.
Thanks so much, Martin. I'm very happy we got you back on board, because those are very important things to distinguish here. And thanks for Evelyn for always being flexible. And now I want to just quickly thank again my panel, Mr. Martin Onyango, Ms. Rita Anindo, Ms. Lilian Muchoki, and also Mr. John Daluma, represented kindly by Nelly Munyasha. Back to you, Evelyn, for your exciting news, and I'm happy we all stayed online to hear it. Go ahead.
Awesome. Thank you so very much, Saskia, Martin, Nelly, Rita, and Lillian for such insightful discussion around health. And I know even as we're seated in our homes, in our places, it's identical or it's evident that healthcare is going digital. You know, we want to sit at the comfort of our home, call a doctor and say, I feel like I have malaria. Which kind of medicine should I take? And the doctor takes us through a process of understanding how exactly are we feeling. And that's what we've also been doing at Reproductive Health Network with the hotline that we launched in 2020, when exactly we did a survey to understand, you know, with the onset of pandemic, there are a lot of studies and researches showing that women, girls, men, and young people, everyone in the universe is limited to accessing essential services when they need them. We had a spike in unintended pregnancy, increase in GBV, where you don't know whom to call, whom to talk to. You know, cases of unsafe abortion went high, and there was just a lot of confusion amidst the pandemic in understanding how do we control the pandemic, but at the same time have sexual reproductive health at the center of healthcare in ensuring that these services are still being provided and at this time. So as Reproductive Health Network, in collaboration, you know, with great minds who've done a lot of work around health in collaboration with organization, and especially also the young people at the center, because we had them in mind, the adolescent girls. How do we support you? How do we give you these services when you need them? You know, we did a survey, we saw the gap, and we're like, okay, we can fill this gap by an innovative way, just ensuring let's keep the conversation, let's keep access to services. And that's when we launched the Nena na Binti hotline, which has served close to 5,000 plus people in Kenya, meaning approximately more than 5,000 people in Kenya we have served through either, you know, giving of information through telephone, counseling. When you call in, you speak to trained healthcare, you know, professionals who will counsel you, will need to know what is the issue. If it's an issue of GBV or rape, we can quickly refer you to, you know, other hotlines that are specifically for offering counseling and support for GBV survivors. If it's an issue of accessing safe abortion, how do we assess, you know, how do we assess you as a client who is coming in to access the services, to know how do we help you? Do we send you medicine and then put you in link with the provider to know the process, or do we send you to a service health provider near in your locality just also to know how can they support you? So that's how we've been working with the Nena na Binti hotline. And the amazing thing is that on the digital space, we've been able to reach more than 1 million people, both men, young people, women, girls, LGBTQ persons. We've been able to reach them with factual information where we just share, you know, information around sexual reproductive health. Do you want to know about your contraceptive? Why not chat with Nena na Binti today on WhatsApp, you know? Do you want to talk to a healthcare provider? Why not call in? It's super free so that you're able to talk with a healthcare provider. And through that transition, we've also been able to monitor. We've also been able to just look at how are we able to really key into the gap, provide this good service. And with that, we felt like it's good to rebrand, bring that vibrant face that everyone will feel like, I think I resonate with this face. This is the face I want to speak out for. This is the kind of person I want to call on the other side of the call. And that has been a huge journey. It's been a progress. It's been amazing. And today we officially launch the amazing face of Nena na Binti, the face that you always talk.
Yeah.
Please unmute and contribute more about this new branding for the hotline? Seems like we lost Evelyn for a moment. Nelly, can you unmute and say a few words about the new branding? Please go.
Yeah, she says she's here. Evelyn, can you continue, please?
I think she got too excited.
So we, like, as we wait for Evelyn to come back, we are really, really excited to be having an amazing fest. Evelyn, are you back? Please take it over. She says she's experiencing the same challenge as Martin. So really, I think the highlight was just for us to unveil the face that we're going to see on our social media platforms, the Nena Nabinti Facebook, Instagram, Twitter, everything, all materials that we'll be having. This is the lady, the face that shall be talking to you. This is the Binti who will be receiving our calls, that will be supporting our women and girls when health information and services. We are really excited. It's almost a year and we are super, super excited just looking at the data and the amazing support that we've gotten from our partners, Rutgers, Sierra, Planned Parenthood Global. I mean, we've seen a lot of people just coming in to give us technical expertise, telling us what we really need to do to ensure that we are providing quality services using our mHealth platform. And I mean, we can only promise that it's going to be bigger and better. Evelyn or Saskia, back to you. Then I think we can close up the session.
Indeed, time is up. Again, I would like to thank the panelists and in particular the RHNK Secretariat and the wonderful team behind Nena Nabinti. I think the comment box is exploding. People really like it. And I am sure we will see much more of this fantastic new branding. And I hope together we will continue to work in partnership within our program, but also beyond, to serve the women, girls, and all people that are in need of information and services in Kenya. I look forward to continue this conversation online and hopefully in person really soon. Thanks again to the wonderful panel and all your contributions. Keep up the great work. Have a wonderful weekend. And thanks for the active participation by our wonderful audience. I hope to see you soon. Thanks so much. Kwaheri. Tutaonana.
Thank you.
Thank you very much for having us. Kwaheri.
Thank you.